some really important advancements in the way that we help people with MS prevent and live and manage COVID. So we thought it would be timely to chat to Dr. Anneke van der Walt and Louise Rath again about some of those changes and just update you all on that important information that we've needed over the last couple of years. So I'd like to welcome Dr. Anneke van der Walt, who is the head of the Alfred Health Multiple Sclerosis and Neuroimmunology Service, and Louise Rath, who's the head of patient experience at the service and a MS nurse consultant. So, Louise, we're going to talk a little bit. What's still your best advice for people in this ongoing pandemic for people with MS?
So I think the best advice is vaccines are still the most important, tool that we have to help with COVID. But also, and I think Brett Sutton had a really lovely article on the weekend in The Age that I hope a lot of people have read, that it is about mask wearing, it is about ventilation, and it is about, where you work, that COVID may be here for a long time. So think about where you have gatherings, think about where you go out. There's choices now for cafes outside. We don't want anyone not going out, but, choose wisely where you go. Wear a mask on public transport, in the supermarket. It's not mandatory, but it's your choice, and certainly having an N95 mask is really important.
And what's your experience been, Louise, when you talk to people in clinic? I know your clinic has over, 1,300 people. That's a lot of people to talk to about COVID. So are most people sort of still adhering to those basic sort of advice on preventing COVID?
I think when you have a large group of people, you'll always get different extremes. So some people are still very scared of COVID and very concerned about the treatments that they're on. And some other people are, I'm fine. Other people have had it. COVID wasn't that bad. So you get both extremes. But I think the consistent messaging from our MS&I is that masks N95 when you're in areas where you cannot socially distance is really important. Making sure that you're up to date with your vaccines. We know that most people in hospital are not vaccinated, under-vaccinated, or have lots of other comorbidities. So it is really important. Are you up to date with what vaccines that you're entitled to and what you should be accessing?
We'll go back to the vaccine shortly, but I think it's really important to remember that we still have a degree of uncertainty in our times, and that people are still really responding differently, and that that people all take advice to themselves and make meaning of it. And we all need to sort of, I know it's certainly, we hear that same thing here at MS Plus, that people have got really different experiences and really different fears, and it's important to remember to be respectful of everyone's different interpretation of things as well too. Yeah, but back to vaccines, Anneke, where are we up to with vaccines? It can get quite confusing.
Very confusing, but look, I guess the long and short of it, and it's kind of been made easier now that everybody is eligible for a fourth dose, or a fourth booster, I should say, not a dose, of the COVID vaccines. That's made it sort of a little bit easier to, explain to people where they should be at. So basically, everybody, including people with MS, should be up to four vaccinations now. And then people that are on ocrelizumab, who's been on Kesimpta, people who are on fingolimod or Gilenya, people on siponimod or Mayzent, and the variants of those drugs, like Zeposia, for instance, people on those drugs are eligible for 5 vaccinations that you can have 3 months after your 4th vaccination. So basically, it just gives people with that we know may not mount the same immune response to vaccinations, that extra protection, and that's why that's still in place. So everybody else should be, looking towards that 4th vaccination. But as you guys have both mentioned, there's a lot of people who haven't even had the 3rd one. And I think it's really, it's a really important point to emphasize, because the reason that, we're not seeing people in ICU this round as much as we did with the previous surges in COVID is because of vaccinations. I mean, the virus is also perhaps causing milder infection, but the general vaccination rates in the community is really high, and that does protect everybody. So people with MS should be very mindful to keep those things up to date. As tedious as it becomes and as frustrating as it gets, it's really critical to keep those vaccinations up to date.
And has the information changed around how whether people with MS have mounted a good response to the vaccinations or the outcomes for people? And it's been a while since we've talked. Has that information changed? Are we seeing anything different in the research?
No, I guess the main messages are still pretty similar in that it's being consistently showed now in a number of studies that people on the ocrelizumab, Kesimpta, or ofatumumab, rituximab, and then the drugs that trap cells, and particularly Gilenya and siponimod, ozanimod, those patients on those drugs don't make the same amount of antibodies in response to the vaccination. But reassuringly, people do have normal T cell responses. So the immune system has sort of a dual pathway of developing a response to a vaccination. And even people on those particular drugs still mount an immune response that tells us that they'll get a protection and a response from the vaccination. But we just don't know how long that lasts and how much protection that provides in real life. So and then I guess on the other side, there's not been any further, safety issues reported with these vaccinations. So there's really nothing new that's come to light at all. Whereas on the other hand, we do know that long COVID is becoming an increasing problem and it's being recognised more. So it's pretty much where we're up to.
Okay. Great, thanks. Just need to check in on that one. And Louise, what about the timing of vaccinations for people? Has that changed? When people are thinking about starting treatment or on treatment, can people still have the vaccinations? Is it at any time?
No, so, it is different each state. And I guess, we've come up with a consistent message for our service. So we would like a 4-week gap from these therapies, if possible, so it's easier for Ocrevus. If it's on Gilenya or Kesimpta, we're just doing it whenever they can. So it's just the 4-week buffer either side for patients on Ocrevus is the main message. And that may be different at other places. So just ask for your guidelines as to what buffer your neurologist and team would like from vaccines to those therapies.
Yes, there does seem a little bit of variability, but generally around about the month's time. Yeah. So what happens if someone gets COVID?
So if someone...
So, Louise, tell us a little bit about the antivirals.
So I think, we've probably had about 5 calls this morning. So we've really encouraged patients of our service to ring as soon as they get a positive COVID test, and to test early, not to wait for symptoms for a week and then test. So the aim is to test as early as possible when you have symptoms. Once you have a positive RAT test or a PCR, then to call a service or your GP so that you can access within 5 days of the symptoms the antivirals. That we have 2 available as oral treatments. So most of the patients ringing today had mild symptoms, but were really knowing that their MS symptoms with having an infection were playing up a little bit. So the reassurance that they weren't having a relapse at home, and to keep drinking, and also to get access to those antivirals as soon as possible. So there's 2 different types. There's Paxlovid, which is tablets that you take for 5 days, and it's 3 tablets morning and night. You do have to have a little bit of a conversation about those because they do interact with other medication. So your GP and neurologist will discuss. Or I can never say this right, Monoplavir. I think Anneke's got the proper name for it. But that's 4 capsules morning and night for 5 days. They do taste a little bit metallic for some people. One lady described it as a little bit of, drinking muddy water. but they certainly keep, we're hoping that they keep your COVID incredibly mild and that you remain at home watching not lots of Netflix, taking paracetamol, and just keeping your hydration up.
And Anneke, medically, have you found that that's been something that's really been beneficial over the last couple of months? Have you seen, I mean, there's obviously changes in the actual virus itself, but do you think it's beneficial enough? And have you had any concerns or side effects that people have reported about the antivirals?
Yeah, thanks, Jodi. I think the tablets have, in our experience, worked really, really well. Like, it's certainly, no one that we've treated has ended up with severe infections. And despite the virus generally causing milder infections, we still had our hospitals run again with people with COVID. So there certainly are a group of people, that get severe infections. And I think the availability of the antiviral medications has protected people that are more at risk of a more severe infection, like some of our patients with MS, against hospitalization. So it's been very successful. The other thing that I think has been useful has been the change in how it's been prescribed. So in Victoria, for instance, GPs can now prescribe this. So whereas before we had to really, work towards finding a way that when people contact us, we can organize the tablets centrally from our pharmacy and, all this sorts of operational things. But it's now a lot easier, and people can actually get this from their local doctor as well, if they're in the time limit. And then people do tolerate it really well. Like, the most common side effect with both of the tablets would be, would be nausea and a bit of diarrhea. And like, especially with the Paxlovid tablets. And like Louise said, it's just also, again, then, with the Paxlovid, just being careful of drug interactions. So, making sure that, your pharmacists have a good look at what you're on. And for people with MS, the drugs there, but most relevant is often drugs that we use for neuropathic pain or pain symptoms, which are often anti-epileptic drugs. So those drugs are probably the ones that we would most commonly see as a possible interaction. And then, of course, all of these treatments are contraindicated if you're pregnant or breastfeeding or trying to get pregnant.
So as a neurologist, you're fairly comfortable now in handing over that there's enough experience in the GPs and there's no special treatments or different treatments. Anyone with MS can access these treatments.
Yeah, so anybody with older than 18 who has additional medical problems and MS would count towards that, can access these tablets if they have any symptoms. So, so like we said earlier, the most important thing is, if you have any sort of symptoms, is to test as early as possible, because there is a time window when these drugs are effective. And, you just can't predict how things will go with the virus, and it's better to be safe and not get a severe infection.
Now, I've heard just on the grapevine, non-medically, that there may be some sort of rebound effect when you get off those tablets, that the virus gets worse. Is that just something I've heard on the grapevine, or is it a real phenomena that you've seen before?
I think when the president of the USA secretary talks about it, I think a lot of people have been asking the same question. So I'll let Anneke talk about this one.
Yeah, so it looks like there's quite a number of cases now reported, especially when people are treated with Paxlovid, that about 5 days or so later, people get a resurgence or a recurrence of their COVID symptoms and may even test positive again if they've tested negative. And the thought is that it's it's not a new infection. It's probably that the drug itself didn't penetrate enough cells to kill all the virus. And then with time, some of those the virus particles again just becomes activated. The good news is that it doesn't seem that anybody who gets this sort of resurgence of the infection has actually required treatment again with Paxlovid or any other treatment, and the infections have all been mild. So it is something that has been described, and it could be to do with just the way that we use universal dosing for everybody.
Mm-hmm.
So it could very well be that some people might need a stronger dose or a higher dose, or people have varying virus levels in their blood. But because we can't measure that, everybody gets like a one-size-fits-all dose. But it's, it does look like for some people they may have needed a little bit of a more potent dose to prevent this.
Still a bit more to learn. Another more recent, really, introduction into how we're in our armoury against COVID is for people with MS is the introduction of preventative treatments, and that's something that's really been in the news and and exciting that it's become available. Can you tell us, Anneke, a little bit about that? What sort of preventative treatment is there?
So this is a new treatment that's become available called Evusheld. It contains 2 antibodies with very long names, but this is different than a vaccine, because what this does is it actually provides you with passive immunity, so antibodies that are already can fight off the virus if you are exposed. So the idea is that your immunity would be so high that even if you're exposed, your immune system would just kill it off straight away, and you won't actually contract the infection. So it's very, very effective, and the trials have shown that consistently. And it has been available for people with MS that has been exposed to Kesimpta or ocrelizumab, and again, Galenia and Mayzent and Zeposia. People exposed to those treatments are eligible to receive the Evusheld injections, and it provides you with passive immunity then for about 6 months. So it's something that you could have on top of your vaccines, and the potential benefit of it is, of course, that you have a higher chance that you will never get COVID then, but also that it might protect better against a lot of these new variants that we're seeing. So I think it's really something that we should be using, because it does give us that extra tool.
And what about any risks? Are there any medical risks associated with this medication?
So it is like 2 injections. I guess that's the first risk. You have to have 2 shots in your top of your bum or in your thighs. So there's always a small risk of an allergic reaction, but that's of course very, very rare. And then in the trials that was conducted, it was shown that it shouldn't be given to people with unstable heart disease, so people who's recently had a heart attack, people with chest pain, and problems with blood flow around their heart or ischemic heart disease. And then again, these side effects were extremely, extremely rare, but it was again suggested that it shouldn't be given to people who's had a very serious clot. Whether it was in their calves, like a deep vein thrombosis, or in a brain clot or anything like that, because of the risk of it precipitating that. But so those are probably the only groups of people where we would not give it to. Otherwise, it's very safe.
And can it be given with the medications, or what are the time frames, and will it affect the MS medications at all?
No, so it won't interfere with any medications, and you can have it at the same time as you're coming in for your Ocrevus infusion, in a similar thing with Kesimpta, but there is a bit of spacing required with vaccinations, and also if you've just had COVID as well. I think Louise knows those time limits.
So you should keep 2 weeks away, ATAGI says, between your vaccine and Evusheld. So if you can just keep that mindful. And ATAGI also says 30 days after having COVID, you should wait for your Evusheld, and that's primarily so that you don't infect, if you're still shedding a little bit, or, they don't want positive people coming into a vaccination hub. So that little gap there, although at the Alfred we were giving it pretty, 14 days afterwards as well.
Yeah. Now, I know I chatted to someone a few weeks ago who really felt that this gave her an opportunity to get out and about and resume some of her life. So it was really exciting. I also know that the Alfred was one of the very early clinics to start using this treatment. So, Louise, what's your experience been like in terms of people having any side effects, or people wanting to try this? How's it gone so far?
It's gone incredibly easy. I mean, Evusheld and Atagi had some great one-page fact handouts that patients could read. You do need a consent, so someone has to consent you that you don't have any of these possible contraindications. And then it's been an incredibly easy process. And I've asked lots of patients to give me feedback about, you can't hide that it's 2 intramuscular injections, one after the other, not 2 nurses together getting you both at the same time. But they've all said it didn't sting. It wasn't thick like, some penicillin. So the injection wasn't painful. No one's had a bruise or any lumps or bumps at that injection site. And even though it's listed that some people may get headaches, none of the patients who have emailed me back have said that they got any side effects, and they were incredibly happy, and it was a fast, easy system to get done. And of course, the vaccination hub has closed now, but in Victoria, we're incredibly lucky that it's been set up with specific community pharmacies. So there's a list of community pharmacies in metropolitan Melbourne, but for the first time, we haven't forgotten the country, and there's a great list of country pharmacists. So GPs and neurologists can do this script and send it off to the stockpile. You can request a nurse at these pharmacists who is there between 6 p.m. and 10 p.m. at night. So you can go and collect your drug, get injected at the same time, and then pop home and it's all done, which is fantastic.
I know Victoria is a little bit more organised than the other states. That for people in New South Wales, ACT and Tas, that Evusheld is accessed by what's called the hospital stockpile system, and that means there's a certain amount given to a central lead hospital that other people can fill in forms and access it. And so for people living in other states, it still can be a bit of a journey to being able to sort of access it through their different doctors. Like everything new as well, there's some doctors who prefer to have some blood tests beforehand than others, but I know that the team at here at MS Plus would be happy to help anyone in the other states try and navigate the system. It is difficult, and I did speak to the company who make it last week, who are hoping that the other states will follow Victoria's leads in being able to support access for this. And also at the time they gave me the reassurance that there was plenty of adequate supply. So I think that's a really important message. There has been a lot of messaging around there's not enough to go around. But from my discussion last week with the company, there was that wasn't an issue. There was enough to go around, and that there was enough access for people as well too. So as I said, information changes about these sorts of things every day and very quickly, but it's really great to hear that you've had such a positive experience thus far, and that people who have wanted to have this on board as well as to prevent COVID. It's been something that's really clearly well tolerated. And Anneke, from your reassurance, there's not a lot of medical concerns associated, but it certainly needs that conversation, like you said, Louise, with the consent that really goes through, make sure that your history is okay, and that you are, that you meet the criteria based on the MS medication that you're on for treatment. One of those treatments, Anneke, is cladribine or Mavenclad. What is that? Is people on that treatment eligible or not?
Not, unfortunately, and it's a bit of a problem sometimes how these exclusions come about. But there is a way to actually apply for an exemption. So it has to be approved by 2 doctors, one which has to be an infectious diseases specialist. So it's certainly something that people could discuss with their doctors, especially if they're someone who's just had cladribine, they're still in that first 3 months potentially after cladribine, or one of the really rare, people who develop, a very low lymphocyte count for a long time after cladribine. People in those groups should consider discussing it with their neurologist and seeing if they could get it by exemption. And because we certainly have been able to do that. I think, it's not hard to convince someone that people in that group might be at increased risk.
And the other treatments for MS, my understanding is that those people have a really good response to the vaccine or have no difference. And MS itself, going back to that message, MS itself doesn't mean that you're more susceptible for COVID. It's the treatments that you're on. Is that still the correct information?
Yeah, so the message is still that, MS itself doesn't increase your risk of catching COVID. People who have a worse outcome with COVID is still the same as it was right in the beginning. So it's people that are much older, people who have lots of medical problems, people in residential care facilities, for instance, and then people with MS when they are when they have advanced disability. So, people who are really wheelchair dependent, people who require lots of help with, getting in and out of their chair or their beds. People in those categories might be more likely to get severe infections. And then again, people in these particular treatment and drug exposure categories. So, Kesimpta, Ocrevus, Galenia, Mayzent. Those and that the reason for that is because the vaccine response might be blunted.
Well, thank you both for sharing your experience with this and for leading the way and helping shine a bit of a light. As I said, there's nurses at MS Plus who are really ready and able to support people. We've heard so many different stories about people navigating different access to treatments, and we do know that, like through all of COVID, we've had different experiences in different states. But what I guess leaning on what you've been able to achieve and your success so far with Evusheld and being able to sort of and patients it being well tolerated and something that is certainly worth considering for people with MS if they feel like it. So, any other final words, Louise?
No, I think that's fantastic. I have had one question that keeps being asked is, will my Evusheld be on my AIR, which is the vaccination registry? And it will not be on there because it's not a vaccine. It's a monoclonal antibody. So like if you're on Paxlovid, that's not on your AIR registry that you can see, your vaccination certificate. So it's good to just jot it down in your diary when you had it, but it won't be uploaded for you to see.
Okay. Thank you. Thanks for answering that one, Louise, anticipating that question. And thank you again both so much for your time. We really, really appreciate this journey that we've been on for the last couple of years. But what good news that we have so much more available now to help treat and prevent COVID for people living with MS on those treatments, which can make it a bit harder. So thanks so much.
No problem.
Bye.
Bye.